Elizabeth, also known as Nurse Zabe, here on YouTube and Instagram, back again with another video for you guys. This is going to be part of my toolbox series, so if you see me in the same outfit multiple videos in a row, that's why. I'm filming them all now. I will edit them up and give them out to you a video a day until we are through our whole toolbox. Toolbox video number 1 coming at you is going to be about conscious breathing during labor. So, breathing. It's kind of like the most obvious basic thing that we do. The very first thing you're going to hear when your sweet, beautiful baby bursts into the world is a nice cry, which means that they are breathing. How exciting. So breathing is not something we typically need to focus on doing. It's something we can do when we're asleep, when we're not paying attention. But in labor, conscious breathing is going to help aid in relaxation and oxygenation, which will make your contractions more bearable and more effective. What's really important to remember in labor is that we don't want to hold our breath and we don't want to hyperventilate. So basically everything you've ever seen in movies of people in labor, and this is just true in general, throw it out the window. That's not how we want to breathe. There's no 100% wrong way to breathe in labor to help you cope with contractions, but hyperventilating and holding our breath are going to make the contractions more uncomfortable and can have some pretty negative consequences for you and for your baby, such as decreased oxygenation for the baby if you're holding your breath. And then if you are hyperventilating, it can make you feel really lightheaded, dizzy, even throw up because of the quick blowing off of CO2 that you're doing. So we want to avoid both of those two types of breathing. So whenever you have a contraction, we want to welcome a contraction to come. While yes, we know contractions are uncomfortable, we want to say, come, I'm ready for you, and I'm going to open and soften my body to you. So whenever you start a contraction, whatever breathing you use further down the road, I want you to start off with a deep cleansing breath in through your nose, out through your mouth, using your diaphragm and really your abdominal muscles, and really having a nice deep breath. As deep as will allow. Sometimes you still have baby up into the ribs, but if baby's dropped, this definitely becomes a lot easier. So you're just going to do a nice cleansing breath. I don't know if you saw that, but I felt it. My whole body softened. And that's what we want to do because we don't want to be tense or tight during the contractions. Plus, if you heard that nice deep cleansing breath, that's a nice way to tell everybody else in the room, hey, you, maybe just your support person, that it's time for another contraction. We're going to do this again. And that way, if you have somebody else doing something such as massage or counter pressure, they know it's business. Let's go ahead and keep doing this. So it's nice to welcome a contraction on with a nice deep cleansing breath, soften your body to the contraction, let the contraction come, and now we're gonna ride the wave. Next type of breathing we're gonna talk about is called slow paced breathing. We are going to be doing this when we no longer can walk and talk through our contractions, when we have to be more cognizant of them. Because remember, in the beginning, when we're having contractions, if we can have some distraction and not focus on them, if we can rest even, that is really good. But this is going to be for when things are getting a little bit more active. And this type of breathing might take us all the way up until pushing. For some women, it does. For some women, we have to kind of change things up as we move along. But this slow paced breathing is going to be at about half of your normal pace. It is going to be about 6 to 8 inhale and exhales per minute. And it's going to be that deep diaphragmatic breathing again. If you're a singer, you might remember breathing from your diaphragm, okay? Your diaphragm is the muscle underneath your lungs, so it's that deep abdominal breathing. We want to be doing that because if we're just doing chest breathing, we're not getting those nice deep breaths and that really good oxygen that our body needs, our muscles need to work. So you're going to take a nice deep breath in through your nose for about 4 breaths in, and then out through your mouth for about 4 breaths out. So in 2, 3, 4, out 2, 3, 4. In, 2, 3, 4. Out, 2, 3, 4. If you find having somebody count and do the in and out thing for you, that's where a support person can really come in handy to help keep you grounded in that moment of breathing and getting through these breaths, these 6 to 8 breaths. We are going to ride through this wave of this contraction, and then it's going to be gone. And then when your contraction is gone, again, we're going to do our nice deep cleansing breath, and we say goodbye. We are done with that contraction, and you will never have to do that contraction ever again, and you are one contraction closer to meeting your baby. Next type of breathing that we're going to talk about is called modified paced breathing, and you don't need to remember the names, I promise you. That is not important, but this type of breathing works really well as things are getting more active, maybe during that transition phase when you are really like needing to work through the contractions. Those slow deep breaths aren't working for you anymore. And this is breathing about double time. So it's not hyperventilating, right? It's not it's not that. We don't want to be doing that because we've talked about how that's not great. It's going to be a little bit more chest breathing, a little bit of abdominal, but a little bit more chest breathing, in, out, in, out. And what we can do with this is kind of combine it, sometimes even with a mantra. So, I'm okay. In, out, blow for 3 in outs or for 4 in outs. So when you have a contraction, because we're riding it and it's kind of a peak, I'm going to show you with my hands. So this will be the peak, this is coming down, kind of how this breathing might look. And we can combine all of them too. Things can get really, really specific to you. So I've got a contraction starting. Oh. Oh. We used our nice deep cleansing breath, then we used our slow paced breathing, and then for the peak of the contraction we used some paced breathing, and then we use our slow paced again, and then we use our deep cleansing breath. So breathing during pushing. There is a lot of controversy, right, between breathing when you're pushing and holding your breath when you're pushing. Here's what we know, is that holding your breath while you're pushing can put undue strain on mom and baby, and it can lead to broken blood vessels in mom's face, in mom's eyes, and more pressure in that vaginal area that can lead to more tearing. Sometimes holding your breath while pushing might be a way where you kind of figure out where you need to be pushing, particularly if you have an epidural. But if it's making you feel uncomfortable in any way, 1, you shouldn't be holding it longer than about 6 to 8 seconds. And 2, if it's making you feel uncomfortable, dizzy, or lightheaded in any way, let them know and don't push that way, because we want to make sure that you're getting enough oxygen. Particularly with an epidural, sometimes holding your breath during pushing can be a little bit helpful to kind of feel where you need to be pushing. But breathing during pushing is also really helpful. So when we have a contraction coming, we want to do a nice deep cleansing breath. Maybe even 2, because we don't want to use all of our strength with our pushing at the very beginning of our contraction. We want to do it at the peak. And then those same muscles that you have been using to breathe abdominally, you are going to use to bear down around your baby and curl around that baby and really help push that baby out. So a nice controlled exhale while you're pushing, deep in your throat. Oh. Or letting air escape in a way that is low and guttural. Things of that nature, right? Because we are bearing down into our bottom. But not this. Because then you just took all that power of your breath and you let it go before you were even trying to push. So using that breath and that power that comes along with it will help ease your baby into this world. So the very last type of breathing I want to talk about is panting breaths. So I know we talked, oh, we don't want to hyperventilate. There are a few times when panting breaths similar to blowing out a candle can be useful. So sometimes I will even hold up my finger and say, blow out the candle. So this can be used when we are feeling a really strong urge to push, but it's not yet time to push for whatever reason, or if we're trying to slowly ease out the fetal head to reduce the risk of tearing. Breathing like you're blowing out a candle. That should only be done when directed by your healthcare provider though. There's no magical way of breathing that's going to make your pain go away. But conscious breathing has been shown to have moms have more positive pain experiences during labor because it helps relax them and gives them something else to focus on. And conscious breathing combined with something else in our toolbox like counter pressure, massage, and position change can all be helpful in making moms feel relaxed and comfortable and supported for labor.